Okay, so now we're going to move on to the bridging. This is the one that a lot of people do get little cramps in their hamstrings. And so if that occurs, Daniel, we're going to just stretch that out. In fact, let me show you how to stretch it out. Go ahead and grab behind your thigh with your hands, both hands interlock. Good, and then straighten out like this. Feel how that's tightening your hamstring, stretching your hamstring. Okay, then come back down. So if you get any cramping during this exercise, that's what you do to alleviate it. You should get to the point where you don't get cramping, but you know, we're working on reconditioning you, so we expect that to happen. And by the way, you know, trying to expect what's going to occur, know what's going to occur, if you can pre-warn the patient about it, takes a lot of the anxiety away. So we're going to try to, you know, when we're talking about your core, you know, your abdominal muscles work in conjunction with your glute muscles to decompress the back, okay? And so this is going to be emphasizing a little bit more of the glute muscles than we have in the past. You're always engaging the core, you know, so keep that with you. But for this, we're going to tilt up on your, we're going to rock up onto your heels with both feet. Good. And then squeeze your butt muscles together so your glutes are really tight. Good. And then pick your hips up and hold them there for 5 seconds. Good. I'm going to hold that for 5 seconds and then back down. And we're going to go ahead and do that. Again, try to go up a little higher this time. You notice that's a little bit more difficult. If people have any neck issues, go ahead and go back down. Some people would do better without a pillow at all with this, because as he's lifting his hips, he's getting a little bit of neck, you know, flexion there. So try it without the pillow. Good. Hold it there, hold it there, hold it there. And that's looking pretty darn solid, which you don't want the pelvis to be dropping from side to side. And that'll come up in the next exercise where we're going to watch for that a little bit more. So what do you think about it? Pillow, no pillow, Daniel? What do you feel best with?
I think no pillow.
Yeah. And this is where I might even show Daniel how to do a little bit of a chin tuck. So if you just kind of tuck your chin like that a little bit, feel how that elongates everything there. That's just a nice little neck exercise. Let's go ahead and move on to the second level of this bridge. So Daniel's doing very well on this. He doesn't look to be too challenged. And I don't want you getting bored here, Daniel. That would break my heart, right? So this time you're going to pick your hips up, just like you just did, and hold them there. Okay, now as you're holding them there, let's do a little marching, okay? Where you just pick this foot up for a second, good, and then the other side. And what I'm watching for right now is the pelvis. When Daniel picks his left foot up, I see the pelvis kind of drop to that side. Do you notice that occurring just a little bit?
Yeah.
In fact, put your hands on your pelvis as you're doing this, so that even if you have to cheat with your hands a little bit, it'll give you some nice little feedback. So let's do that. Perfect. And then back down. And then as Daniel masters this, the next level would be, again, it has to be once he's able to do this without the hips shifting from side to side. He's not quite there yet, so I would not progress him to this next level. But for purposes of the video, we'll do 1 or 2 repetitions. And for that, Daniel, you're going to be picking back up. Good. And now you're going to actually try to straighten the leg out. Like that. See how that's a lot more tricky? Mm-hmm. And then the other side. And again, use your hands for a little bit of help if you need it. Good. Excellent. So you're actually pretty good at that. Eventually we want to do it without hands. Believe it or not, crossing the arms across the chest like this make it even more difficult. So that's your basic bridge. I'm going to move on and eventually we're going to be combining some of these activities with the metronome as well.